So you're here for your annual checkup. Okay. Have you been experiencing any toothache or any pain anywhere since last I saw you? Nothing? No chipped tooth? No accidents? Nothing like that? Okay, perfect. Great to hear. Okay. Well then, let's get started. So we're just gonna do a routine checkup and cleanup. Let me just put my gloves on first, because that's hygienic for both parties. And then I have my little stand of all the equipment I'm going to be needing. All the standard medical equipment. Let me just organize it a little bit better. There we go. Okay. So the first one I'm going to be using, or the first one I'm going to be using, is of course, I'm going to be needing a mirror to check the further teeth that you have, and the furthest teeth that you have. Now, is the position you are in right now comfortable for you? A little, not too back, not too back, not too forward? Okay, excellent. And it is a perfect position for me as well, so that way I can reach your teeth well. Now, let's just see what you've got working here. Okay. There we go. Alright. And have you been flossing? Brushing your teeth regularly and everything? At least twice a day? The routine would be, the best. We want everyone to shoot for at least 3 times a day, but, 2 times a day, 3 times a day. At minimum, 2 times a day, though, at least. Some patients think chewing mint gum qualifies as brushing their teeth. As a doctor, obviously I'm offended. As a person, I am just disgusted. No. And then just open up a little wider for me. Thank you. I just want to get... Okay. And then for your top teeth, so let me just inspect. Everything looks okay. Teeth coming in well. Okay. There's a joke by Mitch Hedberg, and he says the only thing more difficult than quitting smoking is starting to floss. I, as a dentist, am offended, but as a person, I understand. Now, here we go. Okay. Just one more quick check around here. And then another quick check around here. Okay. And then say ah. Ah. I just want to check the back of your mouth. There we go. Just to see if there's any sort of plaque built up on your tongue and whatnot. But everything seems in order. Okay. Good. Now, if you want, you obviously accumulated some spit, so there's going to be a little sucker here that's going to just drain all of that fluid out of your mouth. So just say ah again. Ah. Okay, I'm just gonna put that there. It's just gonna suck out all the spit from your mouth that has accumulated. Give it just a couple of seconds. I'm just gonna swish it around your gums, just so that way it gets everything. Here we go. And then on the top of your gum. Well, that should have been also in the bottom, but still. I don't want to miss anything. This will be useful. Just to pull my hair back. Completely unprofessional. I understand. I strive to be 100% professional in all of my dealings, of course. But frankly, fashion is fashion, so I've got to look good all the time. Now, I have my gloves. Let me put these on again. Once again, you gotta keep clean. Gotta keep. I'm on the verge of writing a Black Eyed Peas song. I'm not hip with the children nowadays. Now, I'm going to be flossing your teeth just to remove any sort of hard-to-get gunk and whatnot. But unfortunately, I don't have floss. I just have this useful medical piece of equipment. It will serve me well. Let's see. It's not... I guess it's sharp enough. Okay, open wide for me again, please. All the way wide, all the way. Okay, it's still a bit... You're still having a hard time getting to the exact wideness that I want you to get at. But here, I'm just going to be just cleaning the gunk from your teeth. Don't worry, I'm a doctor. Okay, so just one tooth at a time. Just one tooth at a time. There you go, and there you go. Open wider, please. I don't want to slice your face. Just, there you go. I would ask you questions, considering how that is how most doctors, clean teeth. They ask him questions ranging from the personal to the public and whatnot. But frankly, I understand that there's something inside your mouth that is keeping you from responding. So I won't ask you any questions. There you go. And then there you go. And the reason you're bleeding, your gums are bleeding, is because you don't floss enough. You're gonna need to start flossing a little more. Yeah, me stabbing your gums isn't reason for them to bleed. If you were flossing, that means that they would be strong. Okay, so next time you come to visit me, remember to floss, okay? I don't want this to be a repeat. Okay, and then back to this side just to make sure I got everything. Okay. Let me just tap on each one. Tell me if you feel any pain when I tap on them. Okay, pain in that one too. And in that one. 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 You should really go see someone about that. That isn't right. Now for the top teeth. I'm going to be needing it to open wide once again. As wide as you can. It's still not wide enough, but it's okay. We'll work with what we have. Okay. So, I'm going to just be flossing the top part of your teeth again. There we go. And then, there we go. There we go. There we go. And there we go. So what are your dental hygiene habits? I'm just kidding. You can't answer anything right now. I'll just be asking you yes or no questions. Do you brush at least twice a day? Sickening. Do you floss every day? Do you own floss? Sure. I'll make sure to put it in your goodie bag. Do you own a toothbrush? Wow. Progress from last year. I'm so proud of you. What about toothpaste? No. We can work on it. I'll give you some when you leave. Don't worry. I used to give... I'm gonna be checking your cavities now, so tell me if anything hurts. They all hurt? Shame. For shame. I used to give Tic Tacs in the little goodie bags, trying to tell my patients, like, listen, next time, please, just please, if I wasn't wearing this mask, I'd be dead. I'd be the spirit of a woman who was tortured and killed by her husband, slaughtered, mutilated even. Come back for revenge. But frankly, since I wear this mask, I'm not that. There you go. Oh, you know about that famous story too? Here, let me get the little suction cup again, just so that way it cleans up all the little spit you got. So open wide. Yeah, Kuchisake-onna. That's a great story right there. The Japanese really do have an active imagination. It's a shame they live on an island, so if any of that stuff actually happened, there would be nowhere to run. Unfortunate. Truly unfortunate. But I am going to be needing you to open wider so that way I can start cleaning your tongue. No, I'm afraid that this is not as wide as I need you to go. I'm going to be needing you to go very, very wide. You can't go that wide? Don't worry. I'll help you out. But first, I need to ask you a question, okay? It's a yes or no question, so just say yes or say no if you want to. Or you can just nod or shake your head. The question is, am I pretty? What a great answer. Am I pretty now? Great answer. Now I can do my best to I can make your mouth wider now. So just open wide. I just need to get a good reach, of course. So open wide, just like that. Exactly. Okay. Let me just get the little suction cup thing again so that way it can clean the blood. Okay, so let me just... There we go. Okay. Perfect. This is so good. You're doing so well.